Kids are amazing. I really enjoy them. It keeps me young. At my age, I'm 70 years of age, and if I wasn't doing this, I'd be an old curmudgeon again, you know, and I don't want to ever do that. I understand that one of the biggest challenges that rural health has is that they're struggling to recruit people to come to small communities.
I feel like healthcare is kind of behind in rural cities because there's no one out here. Like, it's very few people.
We have to drive all the way 30 or over to an hour to get to a hospital or a clinic.
Farmers and ranchers, we all deserve the same healthcare that everybody else gets.
High school kids, they came to me and they said they're interested in getting into a health career, but don't really understand what it involves. So they were saying, is there any chance we could go visit the hospital and that kind of stuff? So I got a hold of their public relations person and we went through the process to get it okayed. There was some pushback, and I promised them I was going to bring them good kids. My first group was probably the best group I've ever had. Okay, we're going to say gynecologist. They almost all went into healthcare as a result of their experience. And it kind of sold the program to them, and then it just grew. You know, when you first introduce it to them, they think doctor, nurse, that's it.
A lot of it is experience, seeing what doctors have to do, what their everyday looks like.
Kind of give you an overview of all the different fields you can have access to in Central Oregon.
We get to shadow different professions and different specialties.
It's just like really cool seeing like firsthand like actually what's going on.
I was really lucky to be in this program. Originally, I wanted to be an ER nurse, and like that, I was set on doing that. And then I was like, oh, I'm in radiology today, and I loved it. I absolutely loved radiology.
For the longest time, I wanted to be a veterinarian, but when I got into this program, I decided, oh wow, I'm actually interested in human medicine, and I would really like to be a registered nurse, especially in the ER. I love the high drama in it, and the nurses have an excellent sense of dark humor.
It's hard to get a kid that grows up in the city and goes to college, and then they try to go recruit them to come to small communities. They're uncomfortable.
So one of my goals definitely is after I finish schooling and after I do that, I want to come back and help the community that helped raise me.
My plan is to go to a smaller town and work in a hospital like that, and really giving back to like small cities.
One of the biggest benefits I had was having Mr. Kurt Davis be there to guide me.
He's a really good teacher because he'll tell you how it is. There's no buttering you up or anything.
He just helped with basically everything.
And the praise from him feels a lot more valuable than it does from other teachers because, you know, with him, he actually means it.
I love him. He's the best.
Best advice I ever got was from my dad. He says, you got to keep one thing in mind. He says, they don't care what you know until they know that you care. And that, I think the kids here know I care.